Imagine you wake up tomorrow, and for 24 hours your teeth could talk. Would they thank you for the care, the attention, the small routines that quietly protected them? Most of us think about dental health only when something hurts. When it comes to teeth, myths are everywhere. Let's start with one of the most common. Cavities are forever. Once you get one, that's it. It sounds logical. A hole in a tooth should be permanent, right? But your teeth are more sophisticated than that. Think of a tooth as a three-layered structure. The outer shell, enamel, is like a fortress wall. It's the hardest substance in your body. Underneath is dentin, filled with microscopic tubes that lead to the center. And at the core lies the pulp, nerves, blood supply, life. When early damage is still in the enamel, something remarkable can happen. Minerals can return. Tiny weak spots can harden again. This process is called remineralization, your body's quiet repair system, especially if you give it what it needs. Fluoride, time away from sugar and acid, and consistent brushing. But once damage passes through enamel and into dentin, those little tubes act like highways straight to the center of the tooth. At that point, the process is no longer reliably reversible. The tooth can still be saved, but now it often needs a professional to step in. So the myth cavities are irreversible is not totally wrong. It's just incomplete. Some are, some aren't. And the difference is timing. Now, let's talk about something people do in their kitchens, not clinics. Maybe you've seen this online. Use acidic fruits to whiten your teeth. Squeeze some lemon, rub some orange, smile brighter. Here's the problem. Yes, your teeth might look whiter for a moment, but what's really happening is erosion. Acid doesn't care whether you are trying to beautify your teeth. It will simply dissolve minerals from the surface. It thins enamel, makes teeth more sensitive, and raises the risk of future damage. Visually, it can even trick you. By roughening the surface slightly and dispersing some of the stain molecules, acids may make teeth appear a bit lighter. But it's like cleaning your floor with sandpaper. It looks better until the floor is gone. If you truly want a brighter smile, there are controlled whitening systems. Carefully measured gels, safe exposure times, supervised treatments. They're not perfect, but they're predictable. Fruit is great for your body, but it's not meant to be a home whitening kit. Here's another big one. Braces are just for crooked teeth. Most people think of braces as a cosmetic upgrade, but your bite is not just about appearance, it's about function. For kids, it's even more strategic. Imagine a crowded subway train. Everyone is trying to get in through one narrow door. That's what happens when adult teeth try to erupt in a mouth where baby teeth have been lost too early, or where there was never enough space. Parents sometimes ask, "Why fix this now? My child is only 9. They don't care how their teeth look." By guiding growth, creating space, and aligning jaws, we make the teenage years and adult life simpler, healthier, and often less expensive. Straight teeth are not only prettier, they're easier to clean. They wear more evenly. They support the face more symmetrically. Beauty, in this case, is a side effect of good engineering. Now let me describe a situation. A child falls, hits their mouth, and a tooth pops out. Panic, tears, confusion. Somebody says, "Well, that's gone forever." But here's the twist. A tooth outside the mouth is not automatically lost. There is a small but very real chance. If the tooth is clean and the person is old enough, sometimes you can gently place it back where it came from and seek professional help immediately. If that's not possible, placing it in a glass of milk, or even keeping it in saliva, can help protect the delicate cells on the root for a short time. Water, surprisingly, is not ideal. It can damage those cells more quickly. Will the tooth always be saved? No, but the myth that a knocked-out tooth is instantly gone removes any chance of trying. And sometimes knowing what to do in the first few minutes makes all the difference. Let's open a different door. The one to your refrigerator. Diet soda, energy drinks, sports drinks. They look harmless, especially if the label says sugar-free. People say, no sugar, no cavities. Simple. But reality is sneakier. Sugar is one problem. Acid is another. Even without sugar, acidic drinks soften the mineral structure of enamel. The surface becomes more vulnerable, more prone to wear. If you then grind your teeth, snack often, or skip brushing, damage accelerates. Juices aren't off the hook either. Orange juice, apple juice. Great for vitamins, not so great for teeth if they're sipped all day. So what is safe? Plain water is the hero of this story. Milk can be supportive too, thanks to its minerals and milder pH. Now, let's talk about something many people assume is one and done. Once I get a filling, that tooth is fixed forever. I wish. Fillings are more like a truce than a final victory. They patch the damaged area, restore shape and function. But the surrounding tooth is still alive, still aging, still exposed to your daily habits. Most of the time, when we have to redo a filling years later, it's not because dentistry failed. It's because the environment stayed hostile. Constant sugar, poor brushing, no flossing, missed cleanings. Think of a filling as a promise. If you take care of me, I'll take care of you. Ignore that promise, and problems come back, often around the edges where new bacteria sneak in. Which brings us to the cleaning myth. I brush at home. I don't need professional cleanings. Brushing and flossing are essential, but they are not the whole story. Over time, minerals in your saliva can harden plaque into calculus, a stubborn deposit that your toothbrush simply cannot remove. It sticks around the gum line, trapping bacteria, slowly irritating the tissue and even affecting the bone underneath. Professional tools, fine scalers, ultrasonic devices, are designed to remove what you can't see and can't reach. Cleanings are not just about polishing teeth to make them feel smooth. They're structured check-ins. They allow someone to look at your mouth with trained eyes and catch small issues before they become big ones. Some people can go 6 months between visits, others need 3. Not because they're worse, but because their biology is different. Let's move to the back of the mouth now. Wisdom teeth. Everyone has them. Everyone must remove them. Actually, no. Some people are never born with wisdom teeth at all. Others have 1, 2, 3, or 4. Some erupt straight and healthy. Others stay trapped under the gum or bone, pushing on neighboring teeth or creating spaces bacteria love. The decision to remove or keep them isn't about tradition. And what about age? When you're old, you just lose your teeth. That's normal. People in their 50s, 60s, 70s whose teeth look better than some in their 20s. How? Routine, prevention, small, boring habits repeated for decades. Yes, genetics plays a role. Some people have denser bone, stronger enamel, more favorable biology. Others face greater challenges from the start. But the goal is not perfection. The goal is mileage, getting as many healthy years as possible out of the teeth you have. You can't rewrite your genes, but you can absolutely rewrite your routines. So if there is one message I hope you carry with you after today, it's this. Brush, floss, use fluoride toothpaste. See your dental team before you think you need to. Because the real measure of success is simple. Not how white your smile is in photos, but how long your own teeth stay with you, comfortable and functional as you move through life. Your teeth are not just tools for chewing. They're silent witnesses to your habits, your health, your years.